You've probably heard of leaky gut, but have you heard of leaky gums? If you've been told by your dentist or your dental hygienist that you have gingivitis or even periodontal disease, then this little video is going to tie in nicely. Hormones influence our oral health through all life stages: puberty, pregnancy, perimenopause, postmenopause, and beyond. Now, when you were of childbearing years, you may have had a little lecture or talk at the dentist or the dental hygienist about keeping your mouth clean, because gum disease can influence or being connected to preterm labor and low birth weight. I actually once went to a lecture about this with a gentleman who had so many degrees. He was a medical doctor, a dentist, and a gynecologist. That's a lot of school and a lot of knowledge. We're not out of the woods yet when it comes to gum disease, menopause, and beyond. Your body can actually become more vulnerable to some of the risk factors that we worry about in perimenopause, menopause, and beyond, namely cardiovascular disease and blood sugar issues like diabetes, or even insulin resistance, metabolic syndrome, those things. Let's talk about what leaky gums really mean and why this matters so much in menopause. If you're already back here, you know my name is Tanya, and I talk about the physical, emotional, and spiritual changes that happen in menopause. Today, it is a physical discussion. We're talking about oral health. I have lots of videos, well, not a lot, but I have a few videos here on oral health, and I wanted to add to that little toolkit here today. And if this isn't your jam, check out my other health habits, or even some of the things I have on here about mindset, body image, emotional eating, and more. Nice to have you. Before we dive in, I want to say that leaky gums isn't like an official dental diagnosis that you're going to get when you go visit the dentist or the dental hygienist. Talking about your gums in this way helps paint a really helpful picture so that you can understand what could be happening in your mouth specifically with your gums. Now, if you're familiar with that term leaky gut, you know that it is where the lining of your gut is inflamed and the cells kind of pull apart. The tight junctions of the cells pull apart to leave a little space so that byproducts of your gut, including foods, proteins, toxins, leak out into your body. Just like leaky gut, your gum tissue can become inflamed around your tooth. There's lots of blood vessels bringing blood flow and products of inflammation to that area, and they become permeable like your gut. The junctions open up, things can leak out, and things can get into the bloodstream. Chemicals of inflammation come out, and bacteria can also go in. That's what we mean by leaky gums. And here's one menopause connection we don't always want to talk about, which is the drop in estrogen. That changes the way collagen fibers are produced in the body, and the periodontal ligament, that ligament that holds your tooth into the jawbone, is collagen fibers, among other things. So we can have change in connective tissue in menopause already. Add the onslaught of dental plaque, which is biofilm, which causes inflammation. It causes a process in the body when it's sitting in proximity to your gums, and you can have a leaky gum situation. Other things happen in menopause. The mouth becomes drier because salivary flow can decrease. I do have some videos on burning mouth syndrome and dry mouth. So this can happen to a lot of us, not just because of physiologic changes, but also because of medications. When this dry mouth happens, and even as we age, the oral microbiome, much like your gut microbiome, shifts. We can have more pathogenic or harmful bacteria and yeasts and funguses growing in the mouth. If you are a denture wearer, you may know that you can get oral thrush or candida in the mouth. That can happen with dry mouth. And that changes the picture of your gums and may lead to irritation and leaky gums. Just having an increase in dental plaque can cause irritation too. And you may have more plaque with less saliva. Needless to say, the gum tissue can become very fragile. And what's the result of this? More bleeding, more inflammation. You may be at risk for gum recession and bone loss around your teeth. That's periodontal disease. But the bigger issue is something I've already touched on. Once this barrier becomes compromised, you are at risk for bacteria and other toxins going into your bloodstream. We had to be very cognizant of this back in the day as dental hygienists, because we would be scaling teeth, and that introduces bacteria into the bloodstream, and we would have to take precautions with medically compromised patients. This stuff in the bloodstream fuels inflammation, and that is what contributes to the risk of cardiovascular diseases and other chronic health issues. These toxic byproducts that enter the bloodstream increase our risk that we already have of cardiovascular disease, as I mentioned, diabetes, and even osteoporosis or bone loss through inflammation. Leaky gums add fuel to the fire of what we're already at risk for in menopause and beyond. Your tissue reacts to biofilm, which is what your plaque is. This massive goo releases its own endotoxins in your mouth, And that's what stimulates your body and your mouth to become inflamed, hence gingivitis and gum disease. It's also really interesting that having inflamed gums also impacts blood sugar control. There's a bidirectional, a two-way relationship between someone who already has blood sugar issues or diabetes and they already have gum disease. You can be more at risk of gum disease with diabetes, but having gum disease can also fuel the fire of blood sugar issues or chronic disease such as diabetes or insulin resistance. So suffice to say that having leaky gums affects more than your smile. Yes, it can also affect your smile because if you have plaque on your teeth, you can have stain, you can have bad breath, but it does more. It is a huge oral systemic connector in the body and puts you at risk for so much. So what can we do? There's a lot you can do to support your gums, and the two best things would go hand in hand are visiting a dental professional, but what you do at home is so important, and the basics matter. Brushing with a soft toothbrush or an electric toothbrush, using some floss or interdental cleaners, even a little gum massager to help you out with stimulating and removing that plaque. For some people, investing in an electric toothbrush is the best thing that they've ever done to manage the inflammation and the bacteria in their mouth. Stay hydrated. If you are dealing with dry mouth, see what your dental professional can suggest for you to help with that. If you are not drinking enough, that can be one factor, but it isn't always water. You need moisture on the tissues. Check out my dry mouth video. That may be able to help you and give you some ideas to discuss with your dental professional. If it's within your budget, fix things like broken fillings, cracked teeth, because that holds even more plaque and can cause more inflammation in your mouth. Tongue scraping is another one that's an excellent way to decrease the oral bacteria in your mouth. And even the taste of food can be better when you clean the gunk off your tongue. Watch what you eat. There are things that cause dehydration, such as alcohol and coffee for some people, but also sugar. Sugar can be a contributing factor, not to gum disease specifically, but cavities. It does feed the bacteria that live in your mouth and causes a more acid environment. And if there's places in your teeth that are full of cavities or small cavities even, the texture of the tooth changes, and that holds bacteria, and that holds the bacteria against your gums, which can contribute to gum disease. Think about how you can support your gums nutritionally. Things like vitamin C actually contributes to, yes, your immune system, but also building collagen fibers. We need omega-3 fatty acids for inflammation, and even our minerals such as calcium, magnesium, phosphorus, boron can help us maintain bone. And those minerals come out in your saliva to help repair teeth. There's lots of holistic boosts you can do. Things like green tea are very good for overall inflammation. There's so many benefits to green tea. You can also use oral probiotic rinses. And even thinking about stress resilience in menopause, it's very important because when we are stressed, we don't have saliva flow. We get dry mouth when we are stressed. So here is your takeaway. Your gums are like a barrier. When they get leaky, they let things into your body system. This can affect many areas of your body, and this can get a little more riskier through menopause. So if you notice dry mouth, bleeding gums, red shiny gums, bad taste in your mouth, don't ignore it. It's not just your dental health, it's your whole body health. If you found this helpful, I'd love to hear it in the comments. Check out my other oral health videos, and I will be back eventually with some emotional support, some spiritual support, and some more physical chat about nutrition, lifestyle, and all the things that we can do to live a joyous and healthy menopause and beyond. I'll see you in the next video.